Globally, over 100 million people are currently suffering from what is called long COVID, which begs the question, what is long COVID? Well, typically, your COVID symptoms last about 2 weeks, but when they start lasting 4 weeks or more, it's moved to what we're now saying is long COVID syndrome. And we're talking the usual symptoms, psychological ones, the fatigue, the joint pains, all of it. And even though it's more common in the elderly and those with underlying conditions, even young people are suffering as much from it. So now we have to really ask, what is underlying it? How does one develop long COVID? There isn't a lot, but recently scientists at the University of Stellenbosch seem to suggest that microblood clots is underlying this. It's affecting the ability of the red blood cells to carry oxygen to other parts of the body. So this limit in oxygen is what is causing long COVID. And we can see how this works because not enough oxygen going to the brain can cause brain fog, not enough going to the liver, causing liver injury. Same thing with other organs. So the diarrhea we see, the renal impairments, the chest pain that we see in long COVID could all really be due to the fact that not enough oxygen is going there. Fair enough. So how does one prevent themselves from getting long COVID? The usual, stay socially distanced, wear the nose mask, wash hands, and more importantly, get vaccinated. Because recent evidence suggests that getting vaccinated reduces your chances of getting long COVID. More specifically, it appears that it significantly reduces it if you've had at least 2 vaccinations. Now, what if you already have COVID? Okay, how are your chances of then developing long COVID? There appear to be 4 markers. Firstly, how much virus was produced in your body. Secondly, what type of antibodies did you produce in response to this virus? Thirdly, what kind of viruses were already existing in your body before the COVID came in? And lastly, do you have type 2 diabetes? These 4 seem to influence the chances of developing long COVID. And now that we know this, doctors can start targeting therapy to prevent the onset of long COVID. Great. So thank you for listening. I hope you found this insightful. If you did, please like the video, subscribe to the channel. You can click here for a video on a new therapy to treat severe COVID, and click here to watch other news highlights about COVID. Thank you and stay safe.